Hello, my name is Farrokhi, and I have the pleasure of living and working in Seattle, Washington, in the Department of Neurosurgery. About 2 years ago, we started applying the piezosurgery tools at our institution, both in cranial neurosurgery and spinal neurosurgery. And truly over this time period, particularly over the last year, we have found that most of our team members have benefited substantially from the application of a piezosurgery device to replace a traditional high-speed drill in both open cranial neurosurgery, open spinal neurosurgery, and minimally invasive spine surgery. In particular, in the realm of minimally invasive spine surgery, the combination of the Laminectomy piezo device and a camera-based tubular retractor system have allowed for direct visualization, which was previously not possible with loop magnification or traditional microscopy. By having the camera mounted on the side of the retractor tube, it eliminates the need to use a typical traditional optical microscope with which you have to look past the instruments and your hands to visualize the point of impact. This has significantly improved the safety and efficacy of our surgeries, and the application of the piezosurgery device has helped dramatically improve the efficiency of our work without increasing risk. We are now looking through a camera-based tubular MIS retractor at the initial cuts made in the medial aspect of the lamina spinous process junction, the superior aspect of the hemilaminotomy, and then the lateral aspect of the hemilaminotomy and medial facetectomy cuts. As you can see, the piezo device cuts quickly and easily through the lamina, and this is done best by initially creating a trough and then using a slow up and down motion until one can feel the device penetrate the lamina and make contact with the ligamentum flavum or the dura underneath. As you can see, there's a small amount of irrigation that helps wash away any debris that's created by the surgery, and meanwhile keeps the bony and neural elements cool to eliminate the risk of burn injuries. You can see that easy visualization of all aspects of the lamina from medial to lateral allowed by the camera mounted on the rim of the tube retractor. This allows us to keep a suction device and the handpiece of the piezosurgery device in a comfortable ergonomic position while visualizing the blade near the elements. One of the significant learning points of using a piezosurgery device instead of a drill in this setting is that one does not have to hold the device firmly and push with force against the bone as one does have to do with a drill. There's a tension in the hand of the surgeon when they're using a high-speed drill near neural elements because we want to stabilize it so it does not move in any direction and cause harm. One of the hardest learnings has been to relax your hand and let the piezosurgery device do the cutting for you and trust that it will not cut beyond what you need. We basically apply the pressure that we would to a ballpoint pen writing on a smooth surface, and that's all that's needed to make safe, clean cuts on all the bony elements while preserving the strength in your forearm and eliminating the fatigue that comes with a long day of operating with a high-speed drill. As you can see, we are now completing all 3 cuts, and in the corners we cross the cuts approximately a third of the blade width so that at the deep junction there is complete release of all the bony elements against the ligamentum flavum. And then a curette or a Lambot osteotome can be applied to gently pull the hemilaminotomy away from the ligamentum flavum, the medial facet, exposing the underlying neural elements as seen here. We hope you've enjoyed learning about the Mectron Piezosurgery device and its applications to minimally invasive spine surgery. As you've hopefully seen, this device has substantially improved the safety, efficiency, and reduced the ergonomic load on the surgeon and opened up opportunities for the learners in spine surgery and associated operations. Mectron Piezosurgery device and the camera-based tubular retractor system have substantially advanced the application of piezoelectric bone cutting devices and helped eliminate traditional high-speed drills, and hopefully will continue to advance the field. We hope that you have gained a better understanding of this very useful device, and if there's any further information that we can provide for you or your group, please do reach out.